Oh, hello, everyone.
Hi, Jim. Oh, Steve, sorry.
So, looks like we actually have a quorum, but let's wait a few more minutes to see if our other committee members are going to join us. All right. Well, welcome back, Sophie.
Hey,
Good
guys.
good evening.
Good evening.
All right. Both of our Ryan Health people are with us. Um, we're just waiting a few more minutes to see if more of our committee members and members of the public join us.
Okay.
I'm gonna, Maggie Clark should be a panelist.
She's here.
Yep, I'm here.
I don't see her listed as a panelist. Oh, now she is. Okay.
I went down there and saw the paper hanging there that all the meetings were virtual.
I sent you an email telling you that.
I know, but I was off to a meeting that I didn't see it.
Okay, Jacob, who's now with us.
Steve, can I ask you a question? Can we ask people that that speak to turn on their cameras when they do so, when they speak? Because if the camera is off, you get the name of the individual that talk, but then you're looking at the blank screen. And I thought we had something in that the executive committee at some point voted that whenever we meet on Zoom, everyone should be on camera. I'm talking about members of the board.
Yes, all of the committee members have to be on camera. And certainly the people who are speaking should also be on camera while they're talking. But you're absolutely right.
Thank you.
I feel like this is probably where Jim Berlin would say something like, we can't compel people to, but we can ask politely. But we board members need to be on camera.
All right. Are you saying we don't have to speak politely to our board members?
No, we should always speak politely.
Okay, fine. As long as we establish that. All right, I'll just give it another minute or two.
And just an FYI, Steve, I emailed the guy from the ASPCA a few days ago, and he didn't get back to me. I'm a little disappointed that he didn't. So I asking for 2025 data, and I hope that they will get back to me soon. So at least we have data that, I can report back to the committee. I mean, I'm talking about the spay neuter wellness vaccination clinics that they had in 2020.
I'd like to have that noted under old business. So
Okay,
you may have to just repeat what you just said.
no problem.
When
No
we get to
problem.
old business.
Sure.
Okay, I tell you what. We have almost all of our committee members except for one present. So why don't we? I'm going to call the meeting to order at 7:06 p.m. Welcome everybody to the Community Board 12 Health and Environment Committee. I'm Steve Simon, Chair of the committee, joined by my Vice Chair, O.C. Kaminer, by our fellow committee members, Jacob Banis, Darley Cornell, John Francis, and Krista Woodley. And actually, let me formally welcome Darley and Crystal to this committee. I believe I know this is their first committee meeting ever, the Health and Environment Committee. So welcome, and we certainly welcome you to this committee and need you to be on this committee. So thank you. So we're going to, as I begin each of these monthly meetings, I read off from the Daily News what makes this particular month special, month of February. It's American Heart Month, Black History Month, and Health Equity Awareness Month, National Cancer Prevention Month, Children's Dental Health Month. It's a National Wear Red Day, which is an observance raising awareness about heart disease in women. It's a Rare Disease Day, February 28th. It's a National Eating Disorders Awareness Week in the end of February. Teen Dating Violence Awareness Month, and National Condom Awareness Day on Valentine's Day, February 14th. Seems particularly appropriate. So we have our usual lengthy agenda, but it's probably going to be cut short a bit since Pauline Ferranti from the Health Department has just emailed me that she has a personal obligation, is not going to be able to attend tonight, and it's unclear at this point whether Julio Batista from the hospital is joining us. He went to a funeral and is not sure when he's going to be available. So we are very, very happy to have with us leaders from the Ryan Health Network. We haven't really heard from Ryan Health since you guys opened up the Washington Heights office on Wadsworth Avenue, just south of 181st Street, and we certainly are interested in having a closer relationship with Ryan and the great work that you do. You have for people who aren't aware of the Ryan Health, it has an absolutely excellent reputation as providing service in Manhattan and various neighborhoods. Why has the recording stopped?
It's a good question.
Okay, well, we're now joined by Richard Allman, so we now have perfect attendance. But let me just mention, by the way, that the Ryan Health Centers are named for a very important person. William Fitzryan was one of the leading liberal lights in Congress from 1961 to 1972. He was the first member of Congress to speak out against the Vietnam War back in the 1960s. So he established himself as a leader on a slew of issues. So it's very significant that this Ryan Health Network has been named for William Fitzryan. But his district included Washington Heights and Inwood. So we're very pleased to have a health facility named for him in our district. So let me introduce the president and CEO of Ryan Health. Probably going to mangle his name. Daniel, is it Pitchinson?
You got it. No mangling. Thank
No,
you.
oh my God! Oh, fantastic! And Roshana Lynch, an MD, Chief Medical Officer. So you guys want to take it away?
Yes. Thank you, Mr. Simon, and thank you, committee members. Welcome new committee members. As Mr. Simon said, my name is Dan Pitchinson. I'm the president and CEO of Ryan Health. I've been in this role for about 2 years. Dr. Lynch, do you want to introduce yourself quickly?
Yeah, hi everyone. So really happy to be here. Thank you for allowing us some time to talk about Ryan Health. My name is Roshana Lynch, and I've been at Ryan since 2014, and I'm the chief medical officer there and a family doctor by training.
Thanks, Dr. Lynch. Can everybody hear me all right and see me okay? Just
Yes.
On camera. Okay. So we're going to walk through a brief PowerPoint presentation, just a little bit about us.
I'm sorry to stop you for a second. Steve, is the recording back on? Because I don't see it on the screen, and I just texted Naomi.
Yeah.
The recording is not back in. Instead, we are being live on YouTube.
Well, but this meeting is supposed to be recorded, so
All right. So did you reach out to Naomi?
I did.
Okay.
I'm waiting for a reply.
All right. Very good.
Well, my son would be very happy to know that his dad is live on YouTube. I need to tell him later because he's 13. But anyway, I want to thank you, Mr. Simon, for that introduction and overview of our organization. I think you touched on something that Dr. Lynch and I are really trying to move forward, is that for a while, our organization has internally been viewed or had a philosophy sort of that we were a doctor's office and people would come to us. And so as you alluded to that you hadn't heard from us in a while, is that, Dr. Lynch and I and many others, we've changed the culture of the organization and we want to come out in the neighborhoods and the communities we serve, because, seeing the doctor or provider is only one aspect of a community's wellness. And we see our role in community health is not just medical, but also helping with mental health, behavioral health. We sponsored a Little League team in Harlem. We have yoga classes in Hell's Kitchen. We have a food pantry. So that's just some general ideas of what we do besides healthcare. So next slide, Dr. Lynch. I think, are you controlling it? Awesome. So as Mr. Simon said, we were named in after Congressman William F. Ryan. He did cover the West Side. He was very, very progressive. We are the third oldest community health center in the nation. There's about 500 now, and many in our city, but we're the third oldest. We're very proud. We were the first in New York. We have 13 health center sites from the Lower East Side up to Washington Heights. We provide a wide range of services to over 52,000 unique patients. And we have about 220,000 visits last year. So this is our mission and our vision. We're providing high quality, innovative, and responsive care to underserved communities. We try to treat everyone with respect, understand what the community is, listen to the community, rather than tell the community what their needs are. We advocate to ensure that there's health equity and community well-being. And one of our saying from Congressman Ryan was that healthcare is everyone's right and our responsibility. So that's a little bit about our mission, and our vision is that we're trying to attack the health inequities and in our systems and try to alleviate disparities. Now we're just, a lot of the mission and the vision, we're also trying to balance is that we're a federally qualified health center, and unfortunately, we get probably 90% of our funding from Washington. So a lot of our mission and vision is not particularly aligned with the federal government's statements. We're sticking to our mission and vision because we recognize that people in our communities need high quality care, and that, regardless of one's ability to pay or one's station in life, is that people should have access to quality health care. Next slide. So that's what I just said, is Ryan Health serves all patients regardless of their ability to pay. We take Medicaid, Medicare, private insurances. If people don't have any income or can only pay a very little bit, or we have a sliding fee scale. We also work with pharmacies to provide low-cost pharmaceuticals, because it doesn't make any sense to go see a provider, see a doctor, get a prescription, and then you can't pay for it. That sort of counters what the very purpose of quality healthcare is. Sometimes people ask, hey, how are we able to do that? And as a federally qualified health center, we get a higher rate than for Medicaid services than a regular doctor in the community. It's not enough, but at least it's part of why we are a federally qualified health center. Dr. Lynch, do you want to take this one?
Yeah, so just a little bit really quickly about federally qualified health centers. So federally qualified health centers were started during the Civil Rights Movement. It was to provide health care to individuals that were not able to obtain it. But it also wanted to, meet patients where they are. And if there were food insecurities, housing insecurities, look at health equity, look at equity in the community. Federally qualified federally qualified health centers really wanted to make sure that the patients that they were treated lives were better even outside of the exam room. So it's really important for us to continue with that mission. So that's why we partner with a lot of community-based organizations that may not provide healthcare, but may provide, like Dan said in the beginning, a food pantry, or we work with organizations that do medically tailored meals for patients that may be unable to provide home cooked meals because they may be living in transitional housing. So just looking to see how we can partner with organizations to not only just provide healthcare. It doesn't stop there. We need to find out what patients need in the community and recognize that, because they have to be treated as a whole person. So that's kind of how federally qualified health centers came about, and we want to make sure that we continue in that mission. A little bit about the patients.
I think what's
Yeah.
also worth noting here is, as far as I know, yours is the only federally qualified health center located in our community.
I think that's correct. I don't know if Community Healthcare Network has a small location, but
Oh, they do, yes. Yeah,
So-
they have something down around 159th Street. Yeah.
but we're the
Yeah.
best one. We're the best.
We serve 52,000 patients in the year, 225,000 visits. 88% of our patients are low-income patients. 70% of them are on Medicaid and or Medicare. 8% of our patients are uninsured. And with all of the threats that are coming from the federal government and not wanting to subsidize the Affordable Care Act health plans, we could see that be significantly higher. But we are a safety net healthcare center, so we want to make sure that we continue to be able to provide healthcare and quality care. Over 3/4 of our patients are people of color, and we have served over 10,000 asylum-seeking children and adults, or New Yorkers, since the arrival of over the last couple of years.
I bet though, if you were to zero in on the on your patients at the Wadsworth Avenue Center, you might find that that you have even a higher proportion of low-income Medicaid people of color at Wadsworth Avenue.
Yes, this is based on all of our sites collectively. Yeah.
Right. Yeah, at some point I would love to see the numbers just for Wadsworth Avenue.
Okay, we can get those for you.
Absolutely. This is just showing how, far our health centers go from the Lower East Side up to Washington Heights, with 7 base primary care centers, 3 school-based health centers. This is a little bit about us. We also have a mental health department, which is vital to our patients. And we ensure that patients are being able to be seen by therapists, psychiatrists, or sometimes even treated by their primary care providers.
Okay. Go ahead, Dr. Lynch.
So this talks about the location that is in Community Board 12. It's 154 Wadsworth Avenue, and also our mobile health centers. You'll see that as well in the community. Our mobile health center is a primary care site. We are able to do exams on there. We take it to some of the NYCHA buildings or complexes or places where patients may not know that we have a health center, just to make sure that patients see that we're there and we're there for the community. Like I said, we provide mental health services for adults, seniors, students, and we also provide chronic disease. Prevention is key, but also management. Some of the primary care services that we provide are on the slide. Primary care for adults, children, adolescents, women's health, prenatal care. We do HIV primary care. We do a lot with vaccinations for our pediatric populations as well as adults. STI testing, PrEP and PEP, which is to prevent exposure to HIV, but also post-exposure. If people believe that they've been exposed to HIV, we're able to provide them assistance on that. We do breast and chest feeding, lactation support, which is really important to our youngest patients and our patients expecting. And then we do cancer screening, and we also have a healthy weight loss management program where we provide obesity medicine to the community. And we were really like on the cutting edge of doing that when it was like a cash for service, when everyone was getting prescribed medications that people couldn't afford. We were actually servicing the community with obesity medicine specialists looking to help people with weight loss. Just some of the ancillary stuff that we do: dental, eye exams, nutrition, gastroenterology. We have a geriatrician, a urologist, podiatry, case management, radiology. So these are just some of the other services that we provide on top of the primary care. And then this just goes into our mental health services. So we do a lot of group therapy. We screen all of our patients for depression. We do medication management, psychotherapy, therapy. This is really something that the community always needs more of, especially since COVID and the increase of social isolation. So these are really important things for us to provide.
Yeah, and these are key partnerships that we work with. So, it just shows the breadth of our commitment to working with not only other health providers, but also wellness providers in different parts of the city or different parts of Manhattan. Especially these days, money is always tight for safety net providers. So we really have to band together to be able to meet community needs and individual needs and family needs. So I think, oh yeah, so what we're also doing is we're building, we have a board of directors who govern the health center. One of the unusual or different things about community health centers is that when it was set up in the 1960s, is that there was a requirement in the law that over 50% of the directors be patients. So it was built on the philosophy that the people who are getting the services should be governing the organization. So we're always looking for board or directors. So if you're interested, I already know you're on CB2, so you've got a lot of work, but if you know somebody else or you have the extra time, we are looking for leaders who are interested in making impact, having leadership experience, and giving back to your community. So, let us know if you're interested or if you know somebody who's interested.
Is Ron Guy still chair of the board?
Yes, Mr. Guy
Yeah.
is. I won't tell him that you said still, Mr. Simon, but
Oh,
I'll say that yes, he is. I just before we get to the discussion, just very briefly, in terms of the scope of health centers in the United States, 1 in 8 Americans or individuals in the United States is getting their health care at a federally qualified health center. I will also say is that I think it's like 9 cents on every dollar is invested in primary care in our country, and that health centers save about, I forgot what it was, some huge percentage of prevention and primary care work. They keep people out of the emergency room. They keep people out of being hospitalized. It's a much less expensive way and to spend on healthcare. So we're always advocating. Dr. Lynch and myself, we're going to Washington next week. We were in Albany a couple of weeks ago, and we appreciate the community board support in advocating for primary care and prevention services with their elected officials and in their neighborhoods. I guess I'll wrap up and say, if you know somebody who has no insurance or has Medicaid or Medicare and doesn't know where to go, is please reach out to us or send them to the Wadsworth location. We can help people get insurance, or if they don't qualify for insurance, we'll still see them.
Well, I just want to say that I have an enormous amount of respect for Ryan Health, and I've been dealing with Ryan Health since I think maybe there was only one location on 97th Street. Um, and so, I mean, I don't know.
Society.
I'm sorry. So I just, I think it's wonderful that you guys finally moved up to Washington Heights. It's great that you're here, and I certainly would love to have more frequent contact with you and with the people up in Wadsworth, and have you come to our meetings more often, report to us on what you guys are doing, and I'm particularly interested in helping support also the mobile van. I guess I was in touch with somebody at Ryan Health a couple of years back when we were really intensely interested in trying to encourage people to get COVID vaccines, and we were talking about co-sponsoring having the van located in different places in the community to dispense COVID vaccines, and I don't know. It's I never got it together to really put I dropped the ball on this maybe, and I didn't get it together to really make sure that we could have that we could have that ban in conjunction with Community Board 12. But I certainly want to encourage that, and have you continue to provide vaccines for flu and whatever else is out there, especially at a time when people are getting the wrong message from Washington that vaccines are not effective and are not, they should steer away from them. So I really want to work more closely with Ryan Health. That's my message. Do any of the committee members have any questions?
Yeah, my hand's up.
Who is that?
Richard,
Oh, go ahead, Richard.
you remember you acknowledged that I was here.
No, I know, but I don't see every. Oh, here. OC also has her hand up. Okay, go, Richard. Go ahead.
I'm going to be very brief. I work with a group of senior centers that are in both Washington Heights and Harlem. The services in terms of vaccines, educational programs, screenings that Ryan Health has provided in this case, in the context of senior centers, and that being an important venue for delivering healthcare and health education. This is just adding to what's been said as total appreciation.
Yeah, I tell you, I don't know if you saw that slide, but the logo of ARC 16's logo was on that slide of the various community partners.
Thank you, Mr. Ellman.
It fits, and I'm sorry I missed it, but I'm working from my phone instead of a desktop.
Oh yeah, no, they're
Thank
bragging
you.
about the relationship with your organization. OC, go ahead.
Yeah, could you go back to the map with all your various locations for a sec?
Yes, give me 1 second.
Okay, while you're looking for the map, if I'm not mistaken, and Steve, if you can correct me, our district is the poorest in Manhattan. And it
Um,
seems,
I don't
let's go to the map for a second.
know. We might.
Okay.
The Lower East Side isn't. May have it,
The Lower East, I was thinking the Lower East Side, but okay,
And-
second
and-
poorest.
and then you
Okay.
have East Harlem. I don't know.
I don't know about that anymore, but one of the
Okay.
poorest, can we agree on that?
Oh,
And
definitely.
it
Yes.
seems
Okay.
like that we definitely one of the largest, if not the largest one in terms of population. I think we are at 210,000 residents in our district, and it seems like we only have one location here. I understand that funding is probably an issue, but what are your plans for the next 10-year-ish in terms of either opening another brick and mortar facility or increase the mobile vans for, you know, uh, anything like, dental vaccines, mammograms, whatever it is that you guys have that is mobile.
Dr. Lynch, I can take part of that. So at the location at Wadsworth, it was an old movie theater. So we are working with an engineer to see if there can be a second floor or a partial second floor where we can move administration. There's a small administration area because on the first floor, and then we can convert that area into exam rooms. So that would add 2 or 3 exam rooms. So that's one strategy that we're looking at right now since we're in that space. Another one is that we are, we're looking to move to Mr. Simon's point is, the initial Ryan Center is at West 97th in Columbus. That area has rapidly, gentrified over 25 years. There's a Whole Foods across from the health center. The population there has aged dramatically, and while we still serve many Medicare patients, so there's a lesser demand from newer patients. So we are moving with my leadership and Dr. Lynch's leadership. So we are gonna, and while this is not in CB12, we're moving up to 135th and Broadway. There's a large demand there. We are going to be on Fordham Road in the Bronx, and we are looking at locations. We're trying to find locations in Washington Heights and in Central Harlem. One of the problems we have is that even though there's great inequities in income in many neighborhoods, real estate in Manhattan is, and most of New York now, is so ridiculously expensive that as a not-for-profit community health center, it is very, very difficult to locate either a space to purchase or to even rent. So, even on the Lower East Side, there's been tremendous gentrification. It's very, very difficult to find things that we can afford.
So
Yeah.
is it true to say that you have, well, actually, no, let me ask it as a question. In terms of district, which one of the districts in Manhattan have the largest number of uninsured? I'm talking about health insurance.
Yeah, no, I understand. I don't know if I know the number off the top of my head. I used to know, I think it was the Lower East Side before the Affordable Care Act was passed. And as the slide said, I think we're down to about 5%. What we don't know what's going to particularly happen in the next year and a half is, well, we know that number is going to increase dramatically as part of some of the federal legislation that was passed. There's going to be work requirements, and that's really just a way to force people to lose their health insurance. There's no way for the state to verify it. The federal government's going to look for every possible way to reject insurance.
But I think OC may have a point though that in terms of uninsured people, we're probably way up there. So to the extent that maybe there is development going on up in Inwood, and I don't know what they're charging for retail or commercial space up there, but there is the possibility of space opening up in the Inwood community.
Right, and it's very close to the Bronx, really. So right on 9th Avenue and 219. So it's, you kind of sort of can serve the Bronx and Manhattan and our district at the same time.
Yeah, no,
But,
definitely at Wadsworth because it's so close to the bus that comes. So we have many patients. I mean, I can get you the payer mix and some
Yeah.
of the data for Wadsworth in particular.
Yeah, that would be,
What we also have been doing is working with elected officials, and there's been what we're trying to do is when, say, developers are going to put up buildings, whatever, is that we're trying to work with elected officials to have them include community benefit organizations or not-for-profit organizations. So that's evolving. You know, with this new mayor, I think we'll have more success than we probably have had in terms of you know, hearing it. Also is that I don't know so much. I know this in Chelsea more is that the city is doing work with Chelsea Fulton
right,
public housing,
right.
and that so the developer is in discussions with one of our locations about putting a health center in one of the as a community benefit so that they can build. So there's, you know, we're trying to work every single angle. And as a community board, if you know of a place that you think is worth even us looking at, you know, I wrote down 9th and 219th, you know, we'll look, because to your point, even neighborhoods that have gentrified, there's need everywhere in our city. Like, you could live in many, many buildings. There can be people who are paying $5,000. We see this in Hell's Kitchen or in the Upper West Side, people paying $5,000 a month. And then a family who's been in that apartment for 50 years and are double, or there's 3 generations living in there, and maybe they're paying $1,400 a month for a lot of people. So it's, you know, it's what I call micro inequity.
Right. Well, we should definitely keep this in mind. And as we hear of potential projects where they're talking about having community facilities, we should keep you in mind as maybe a possible.
There was a discussion, Steve, about this for this building on 9th and 219. There was a whole study about that. So, I mean, the building is not yet there, but
Right.
maybe it's early enough to start having a conversation with the developer.
Yeah.
Yeah, that would be
Alright.
perfect. I
That's
mean,
a
I
good
can
one.
offline reach out to you, Mr. Simon, or
Okay.
OC. And I did put usually when we're in person, I give out business cards. I did put my email in the chat, just that if anybody has a question afterwards or thinks of something, feel free to reach out to me.
Okay, very good. And that's Daniel Pinchinson at ryanhealth.org.
That's right.
All right, very good. All right, Eddie, Richard, is that a new hand or an old hand?
I'm an old hand, and that's an old hand.
Okay, very good. I was going to say something like that, but I'm glad you did. I don't see anybody else. That's great. So, all right. So, Daniel, Roshana, you're now our good friends, and I'm hoping that you or maybe the people at Wadsworth will visit us on a recurring basis, because we really would like to establish a much tighter relationship with the Ryan Health, and I certainly do want to explore the possibility of supporting or maybe co-sponsoring some of the visits by the mobile van, and especially if we can try to get the message out with using the mobile van about getting people vaccinated.
And maybe,
Absolutely.
Steve, if there are any flyers that you guys produce to highlight some events or something that you're doing at your clinic, then maybe you can share with community board office so we can spread the word.
Yes, excellent idea. We should definitely do that. And we should definitely help support you and your efforts to reach out to people in the community.
Thank you. That means so much to us. Outreach is such a big part of what we do, but all the help that we can get to let people know that we're there for them, and we want people to feel welcomed.
Very good. And you should feel free to use us because we want to feel free to use you. So That's great. And Crystal, did you have a question or comment?
I just want to know also, is there religious outlets that you're also using to get the word out?
Yeah, so we do a lot of faith-based events, and we partner with them when they have block parties or community outreach. We do a lot of tabling at a
Okay.
lot of the faith-based churches, and yes, we do a lot of things within the faith-based community.
Okay, that's good to know. We can keep that out there too to push your great agenda.
Yeah,
Very good.
thank you.
All
Thank
right.
you.
All
Okay,
right. All right.
thank
Thank
you.
you. Thank you, Ryan Health. And please feel free to reach out to us.
Okay,
Thank
thank you.
you. Have a great
Bye-bye.
night.
Bye-bye.
Thank you.
All right. Next on the agenda, very important topic about the New York City's solid waste management plan. Uh, in case you're not aware, solid waste basically refers to our garbage, and the solid waste management plan lays out lays out the city's plan for how to deal with the enormous amount of garbage generated in this city. So we have somebody here who's been studying this issue for decades, and is the chair of the Long Range Planning Committee for the Manhattan Solid Waste Advisory Board, Maggie Clark. Maggie, where is Maggie?
I am here.
Very good. You have a PowerPoint, I believe.
I do. Can I share?
Why not? Is there
Okay.
any reason she can't share?
You should be able to. Let me double check.
Let me see if this works.
There you go.
Ta-da. Okay.
Oh, here we go.
All right. What I sent you earlier is missing this page. I sent it the minute that I finished it, 4 hours ago, 5. And there we go. So, yeah. All right. So we use SWAMP, SWMP, Solid Waste Management Plan, because it's a lot of words. So we call it SWAMP, and LSWAMP is just local. So where do these solid waste management plan SWAMPs come from? It was state law, 1988. The Solid Waste Management Act of 1988 requires all localities to do a plan every 10 years on how they're going to manage their solid waste. Now, part of this law included something called the solid waste management hierarchy. At the top of the hierarchy, meaning the most preferred thing that you should do, is to prevent waste. And then second below that is reuse, and the third below that is recycling. Fourth is composting, fifth incineration, and finally landfilling. Unfortunately, and you can see here that this language is taken right out of the law there, and I put in red kind of the most important parts, that the plan should outline a 10-year strategy to reduce disposal through waste prevention, reuse, recycling, composting, and organics management. And it's the responsibility of New York City to produce as detailed, concrete, and realistic as possible a plan to ensure that it continues to be valuable, useful tool for the entire planning period. And I've been commenting on plans since 1990. The local law 19 of 1989 set up the recycling in New York City. And so you have those laws, and there are other laws that are governing all of this. And so there are 3 things that are definitely supposed to be in whatever plan the city comes up with. And that's assessment of current conditions, which they do well. They can assess what they're doing. Evaluation of alternatives and selection of the system. They fall down on that. And then the third, implementation schedule, and MSW stands for Municipal Solid Waste Projections. They don't do that well either. They don't like to commit to anything in the upper hierarchy there. I used to work for them in the 1980s to make their incinerators less polluting. They wanted to build 13 at one point. And so I was the one trying to design them so that they wouldn't pollute as much. Anyway, a lot of time has gone by. And so this is the brief history of solid waste management plans in New York. The first one was 1992. It was 2 boxes of books. It was, amazingly a lot of words, but there was only one thin volume that actually represented the plan. That is, we're going to do this thing by this date. We're going to do that thing by that date, and so forth. So even though there were a lot of words, a lot of milestones, they still evaluated resource recovery incinerators and collection for export. They did look at some recycling and in-vessel and windrow composting and repair and reuse to some degree, but unfortunately, a lot of the things that were in that plan, they never did. And DEC did not enforce. And this is what we've been dealing with. I should introduce now who the we is. The Manhattan Solid Waste Advisory Board was set up by the Local Law 19 of 1989. The recycling law set up borough solid waste advisory boards in all of the boroughs and a citywide group as well. And our job is to be evaluating the plans that they write, to also be evaluating the participation rates, and I'll be getting into that as well. The 92 swamp set the course for waste export. And then they didn't do another one for a long time. And so swamp 2006, that was even more about setting up export. They converted transfer stations so that the marine transfer stations were up and running and ready to accept a lot of waste. And so the problem is, I'll read the red stuff again. This system, waste export, meeting the, let's see, hold on, I have to minimize the okay, sorry. There, I can read it now. So this system, while meeting the immediate needs of both commercial and residential waste streams, is unsustainable. This is their writing. They wrote this in the 2006 plan, that export is unsustainable as a cornerstone of any long-term disposal plan. And so this amazing statement notwithstanding, the current swamp that they've issued as a draft facilitates the transition from interim waste export to long-term waste export. In other words, we're not following the hierarchy at all. In fact, they did away with the Bureau of Recycling and Sustainability a few years ago. So this is a serious problem. So this is just a quick and easy look at the draft, the city's draft swamp. It seems to be created in a vacuum. They didn't look back at 2006 or 1992. They offered 2 possible paths. So business as usual with the same programs, or business as usual with addition of, quote, observe and monitor the programs. And we know, having read things by the sanitation department before, that when they observe and monitor, that doesn't necessarily mean that they are making any modifications. Both paths will lead with high probability to the same endpoint in 2036, not having moved the needle on diversion from export. And the swamp will continue the current system of sending everything to landfill and incineration And the sustainability programs we have will continue on life support as they've done for 33 years. So this is generally what things look like. Waste is generated, goes to transfer facility by the trucks, and then from there to a disposal site. And all of those are out of the city now. We don't have any in-city incinerators or landfills anymore, and we haven't for over 20 years. So here's the big headline. We're spending about $500 million a year to export. That's a lot of money. I actually had the opportunity in May to mention this to Zoran Mamdani. You know, we were interviewing mayoral candidates in the Democratic Club, and anybody got a question for him? So I said, well, do you realize that we're spending $500 million every year to export half of our recyclables, over 90% of our organics, and all of our reusable and repairable products left at curbside? Mainly because we're not spending enough money or inattention to participation. Meanwhile, Manhattan's waste, if you can call it that, because it's, you know, there's an awful lot of good stuff in what we send out. You know, it's mostly organics and recyclables and repairables and not much else. That is burned at the Newark incinerator. So, and the prevailing winds are from the west, so especially in the summer, we can get that coming here. And this shows you graphically what we're talking about, not moving the needle. This just shows from 2012 to 2022, but it's still the case, and it was the case before 2011 as well. And we're averaging about a diversion of about 18.5% away from export towards recycling. And almost all of that is either paper recycling or metal, glass, plastic. We refer to it as MGP. The tiny little sliver at the top, the organics diverted for composting, is mostly yard waste. It's mostly from, you know, Queens and Staten Island yards. There's not much food in it yet. And then if you look further down here, so the textiles are all being burned and buried. The construction and demolition, likewise, they're all the organics. The metal, glass, plastic, the paper that's being burned and buried. And then the refuse, which is down at the bottom, the actual stuff that we can't do much with. And by the way, I suspect that there's a bit of reuse capability in that gray section because we don't have anything listed elsewhere in this graph for things like furniture, electronics, books, clothing. Well, we do have the textiles, appliances, and so forth. And that's what reuse is all about. So you can see we're spending a tremendous amount of money, and most of what we send out to export is not really garbage. It's something we should be recovering here in the city. So why is the needle not moving? We do have sufficient trucks, transfer stations. We have most of the processing we need, and we have the markets we need. The processing, the caveat there is about composting. Staten Island, because they were abused for so long with the landfill there, they don't want any more waste to come in. They want to only deal with their own waste and recyclables and so forth. And that's unfortunate because it's not like if all the other boroughs were to send food scraps to a dedicated composting facility, and they have one already at the landfill for their own composting. It's not like the footprint would increase the size. It would be a size and it would be treated and then it would leave and more stuff would come in. It's not like an accreting landfill, which is getting bigger every day. But my personal opinion is that in order to solve that problem, Staten Island should be treated like one of the host communities where there's an agreement where they get some benefits, you know, as many as they need in order to set up the composting there for the whole city. Because right now, most of what is produced, most of the food goes to these big eggs. They call them eggs. They're co-digesters. They mix the food with sewage sludge. And actually, I think I have a slide about that later. So I'm going to just leave that here at this point. So going back to why is the needle not moving? New York City, for all these decades, has systematically underfunded the programs to increase participation. After 33 years since the rollout of recycling, only half the recyclables are put out with recycling and the other half are put out with garbage. And that's because the people aren't participating. And they have no idea why people aren't participating. They don't do studies. I've done studies. My doctoral dissertation was a study along these lines in the 90s. And I did other studies around 2004 and 2005 to try and understand and get into people's heads, you know, what will motivate them, what is causing the barrier and so forth. But they don't have any interest in that, and they really need to. The model cities do studies and pilots and stuff like that. After 2 years, since organics pickups have started on the curbside, we're at a grand total of 8% diversion set aside in the brown bins. So, you know, 92% of the organics are burned or buried. Since 1989, the city has refused request by, MSWAB, which is the Manhattan Solid Waste Advisory Board, to measure prevention and reuse opportunities. You know, I came up with this as chair of the Waste Prevention Committee back then. And we have been asking every single time that they were planning to do a waste characterization study, and they persist in only wanting to measure recyclables and organics and maybe textiles lately. So they're not measuring a lot of the reuse potential. A group called the Recycling Partnership has calculated that in order to achieve good participation, that education and outreach must be annually funded at $10 per household per year. New York City's been funding a small fraction of this. At one hearing, I heard them say, quote, a few $1 million a year for 8.5 million people. So it's less than $1 per person, a lot less. And so how are they actually functioning? How is the export going? So New York City's discards, I call it that rather than, you know, waste, because most of it is resources, go to incinerators in Newark, Niagara Falls, and Chester, Pennsylvania. As I mentioned, Manhattan's goes to Newark. New York City also, some of the boroughs send to numerous landfills upstate, New York and other states. And the contracts get renewed automatically. One is due this year. These contracts go for like 30 years. So it's really important to get on this immediately. So Local Law 19 in 1989, the recycling law, established these advisory boards. And the purpose of the boards, among other things, were to hold hearings on sanitation department recycling reports, which they don't do anymore, but they did a couple. And now it's these solid waste management plans that we have hearings on. And we held hearings within the last month. All the boards, I think, did. And we're also supposed to advise on how to increase participation. The Manhattan SWAB has met every month since 1988. We actually preceded the law. We were set up as a citizens advisory committee initially. It's produced many reports, fact sheets, the hearings I mentioned, and other hearings, including ones on the swamp. testimonies at every opportunity to the city council, and we've also testified to the state, to various committees as well, to move the needle towards zero waste. That's our main interest. The SWAB has also worked with the other SWABs and environmental groups to produce alternative solid waste management plans. And we're working on one of those right now in my committee, the Long Range Planning Committee. Now, there were a number of laws passed by the City Council in 2023, 86 and 87 among them. And 86 requires that New York City not export any recyclables or organics to landfills or incinerators by 2030. That is a big deal. And their plan does not at all show how to accomplish that. The New York State Solid Waste Management Act of 1988 set out the priority. I mentioned that earlier. And yet, most of the cities, okay, and I mentioned this, the separated organics, the food, mixed with sewage sludge and deposited at the co-digesters in Brooklyn. PFAS, if you've heard of that, it's a toxic forever chemical plastic. Lots of other plastic, lots of other toxics, metals, what have you, are in sludge, sewage sludge. They mix that with food, therefore downgrading the possibility for spreading on agricultural land because it's now a health hazard. If you were to simply compost the food, it's not a health hazard and you can spread it on agricultural land. And then finally, there is a New York State climate law called the CLCPA that requires carbon emissions limits, and they recognize that solid waste management is one of those things that needs to be done right so that we reduce the amount of carbon we're emitting. So this is just from me, you know, I haven't gotten this approved, but I got the impression the last time I was there that I could propose a resolution. So I know you'll do with it what you want. There are a number of whereases here. So whereas New York City is required to submit a 10-year solid waste management plan to New York State DEC, outlining a 10-year strategy to reduce disposal through waste prevention, reuse, recycling, and composting and other organics management in as detailed, concrete, and realistic as possible. I should have put in the extra word method to ensure it continues to be a valuable and useful tool for the entire planning period with an implementation schedule and MSW projections. Whereas the Department of Sanitation, New York, has released a framework in its terminology that does not lay out a set of detailed, concrete, specific initiatives in waste prevention, reuse, recycling, and composting with a implementation schedule making very few commitments in their framework. Disney's framework allows for and may result in continuation of export of 50% of our recyclables, over 90% of our organics, and all the discarded reusable items to be burned and buried in landfills and incinerators. Whereas the city has systematically underfunded studies, pilots, educational materials, and outreach approaches that motivate all types of New Yorkers across the city for 33 years, and diversion rates from export have been stagnant around 18%, whereas the city has numerous long-term export contracts that make it easy to send recyclables, organics, and used consumer products to landfills and incinerators. Whereas there are local laws, 86, 87, and related, that require no landfilling or incineration of recyclables or organics after 2030. Whereas the state CLCPA climate laws set out carbon emissions requirements and states that waste management is a significant contributor. And whereas the Manhattan SWAB is working on its third alternative plan since 1991, resolved that CB12 requests that the Disney produce a plan as required by New York State and New York City law as described above, with the advice of the borough solid waste advisory boards, and designed to move towards 90% diversion from export, and resolve that CB12 requests the city council to provide sufficient annual funding for participation studies and pilots, educational materials that motivate all to participate, outreach approaches that are varied and frequent, and that enforcement be funded consistently across the city as a deterrent to non-participation. That's it. I can't hear you, Steve.
I want to thank you for the presentation and for giving us that comprehensive overview of the issue. If you could just go back there.
Yeah.
If we're advocating this 90% diversion from export, wouldn't that be inconsistent with the local laws that say that there should be 100% diversion by 2030?
Actually not, but it's a good question. So the local law was developed without as much input from the swabs as we had hoped. And it only refers to recycling and organics. And there's a lot of other stuff like the reusables that are not included.
Yeah. All right. So it's 100% diversion of all potential recyclables and
And
organics.
Yeah,
But what you're looking at here is a 90% diversion of the entire waste stream.
exactly. Or
Okay.
discard stream.
Yeah. All right. Very good. All right. Are the committee members have any questions?
Should I put any of it back up?
I do have a few comments.
Yeah. Go ahead.
So I know that the NYCHA residents are paying for garbage disposal. We don't. If you don't live in a NYCHA development, you don't pay for it. I mean, you pay through the taxes, but they have a specific fee just for pay to trash, if you will. So I don't think it's a bad idea to do that because the European countries are doing that already. You pay by the kilogram. And so I think people will pay more, some will pay more attention when they pay to pollute. That's what it is. Or pay to dispose or whatever. Maybe there is another name for it.
There's a name. It's called Pay As You Throw. And
Okay.
several years ago, the city, when they thought they might be interested in it, called it Save As You Throw, but then they abandoned it.
I do remember some discussion about that in 2018, 2019 maybe. Some organization came with like, okay, we have to start paying for what we trash because that will people will pay more attention to how much packaging they consume and how much stuff they consume. And I think that it's just gonna create a situation where more people will either, I mean, like use those, various social media platform to give away stuff instead of tossing them away. Also, I think one of the things, Maggie, and I don't know if this is something to highlight, but a lot of people don't understand how to recycle. I mean, like they recycle the wrong stuff, or so there is this problem.
I did research on this, with 2-page questionnaires around 2004 and 5, and I had CUNY students going out with these to grocery stores and having people fill them out all over the place, and I got thousands of them back. One of the most important questions that's burned into my brain from that time was, if you don't recycle every time, what's the main reason? And I gave them like 5 or 6 really plausible reasons, like, I don't have the time. I don't think I should have to. I forget. I'm confused. and there are like one or two others, but it was like that. And 60% of the vote went to two of them, and it was, I forgot and I'm confused. And that just
Okay.
shows you the failure of the sanitation department, to get to everybody. You have to look at it like the advertising industry. When McDonald's is advertising hamburgers, they don't just send you a brochure once a year and they think they're done. It has to be repeated in so many different ways,
Right.
targeted at different people and demographics and all kinds of things. There's a science to it. It's called behavior science, and that's what
Right.
my dissertation was about. And a lot of people are expert in this across the country, but sanitation needs either that or it needs to be taken away from them, which did happen actually for a while. We had suggested back in the early aughts that, they seemed to be incapable of doing education and outreach properly. So they gave it to Council on the Environment, which became Grow NYC. But then they didn't give them enough money. They were just squeezing, and so they couldn't do as much as they needed to do. And then in the last, I don't know, 2 or 3 years ago, when the budget was a problem, they just yanked all that money away and fired all the people at Grow NYC that was doing this. So they're
So
incorrigible. What can I say?
should we, I mean, I'm maybe you put it already in the in your resolution that, but should we add something about, the city need to consider pay, I'm sorry, Maggie, I'm
Pay
spacing
as
on
you throw.
how
Yeah.
pay as you throw.
Yeah,
Um,
that would be a resolve that, one of the final things, that it should do a
Well,
study. Actually, they were planning to do a study. It was $1 million study about 5 years ago. I knew who was going to do it. I knew that, like, the person who was, the country's leader on pay as you throw was going to be a sub-consultant. And then all of a sudden they pulled that. And, I remember hearing it from their end. They were not happy. So it's very easy to misunderstand pay as you throw, because people who don't want to see it will call it a tax. And what it actually is
I,
instead of having it buried in the taxes where you don't know how much you're paying, then it's taken out of there. So you don't have to pay as much tax, and you pay based on the tonnage of the actual garbage that you're throwing out, not the recyclables, not the organics.
right.
but but isn't that very difficult to calculate when you have people living in apartments? I mean, how you
Well,
how you
I'll
going to
tell you.
quantify what each apartment resident throws out?
So I figured that out in the 90s. And I worked with a woman named Eve Martinez, who worked with High Rise Recycling
Yeah, I
and with
remember.
the sanitation department for a while.
Yeah.
And we put in a grant request both to EPA SBIR, which didn't take hold, but to NYSERDA, which was very interested. And what we were planning to do is to retrofit a high-rise recycling unit. Let me explain what that is. If you have an old garbage chute, which isn't used for an incinerator anymore because I got a law passed in 1989 to kill all the apartment building incinerators. So there are a number of chutes available, and you put at the bottom of the chute, you take out the incinerator stuff and you put a Lazy Susan with big barrels, and one is MGP, another one is paper, another one is garbage. And at the top, when you're at the chute, you push the button to say which one you want. And then you put the paper or whatever it is, and the Lazy Susan is rotating as you do that. So I thought, okay, that's the beginning of a pay-as-you-throw apartment building system. So you have to retrofit it in two ways. And I sort of thought that this was actually feasible. They liked it. And let me tell you the two ways. One would be that each tenant would have a barcode
Yeah.
card which then could be shown to the system and would identify you, allow you to get into the system. And then if you chose garbage, then not only would the lazy Susan at the bottom turn, but a scale would come out to measure the weight of the garbage and charge it to your apartment.
Yeah.
And then let it go.
Yeah.
That's a good
And
one.
so NYSERDA liked that. And all they needed was that the sanitation department attend a meeting about it, and sanitation refused to attend a meeting, even though they were not even involved. They were not going to be called upon to do anything.
All right. Well, I don't know. I don't see how this is feasible. I would rather that we advocate for the reestablishment of the recycling outreach program at Grow NYC or wherever it should go. But I can't believe we don't have. It's no longer in existence. How the hell can we? How can we encourage people to do recycling? We're not doing any serious outreach.
That's the problem. And that's been the problem. You know, it's never been enough. It's
Yeah.
never been anywhere close to enough.
Yeah, but now we have nothing. You're saying.
I know. Yeah. Now we have almost nothing. I think they did a little outreach for the organics, but that's kind of ceased at this point.
Yeah. You mean for the composting?
Yeah.
Right. All right. You want to just put your last slide up on the screen for a moment?
Okay.
Steve, you have another question here from Darley.
I'm sorry. From where?
I'm sorry.
From Darley. Oh, I'm sorry. Darley, go ahead.
Thank you. I will try to be quick. Quick question. With the idea of pay for what you throw, do you have a sense of how low income family and low income community are considered or prorated on that pricing?
Yes. All of the problems of, that one could think of for pay as you throw have come up in one or another or many of the thousands of cities that have been doing this for a very long time. I mean, the EPA started suggesting this back in 1990, and in 2000 they held a full-length conference just for the sanitation department to try to get them to accept pay as you throw, and obviously it didn't work. But yes, so to answer your question, that has come up. It's been dealt with. There are allowances made for lower income, elderly, etc. Another question that sometimes comes up about that is illegal dumping. And so, there are solutions. I remember probably 20 years ago, Tompkins County, which is Ithaca, they've had it forever. And so they presented at a conference, and people asked them that question. They said, well, we know where the dumping spots are, so we set up video cameras, and then we show it on TV and embarrass people. Yeah.
All right. Well, let's look at I would like to play around with these with the wording of these two resolve clauses a bit, and I would want to really hone in on the idea of providing funding for a much more for an extensive recycling education and outreach program. In fact, you may recall this is one of our annual budget requests. Every year when we do when we rank our budget requests, one of them is to have a more extensive recycling education and outreach program. So this, it would make sense for us to put that more clearly into this resolution.
And the other one is to have, I'm sorry, it may not sound like it's belong here, but it is to some degree, is to have the sanitation facility completed in the Upper East Side,
Yeah, well, that is a somewhat different issue, but which we should also be pursuing, more, more consistently. But it certainly would make sense for us to be talking here about doing a much greater recycling and recycling, waste reduction, education, and outreach.
Yeah, in fact, I should have included, but I hope you would include the recycling partnerships, $10 per household per year
Well,
as specific request.
now I don't want to do that. That's we're talking then about like 80. How much money are we talking about there?
I think I calculated it to be about 33 million. Now,
Yeah,
remember, we're spending 500 million to
no,
export.
I know.
And so if we can claw back a lot of that tonnage and put them into local programs, which will employ people locally to be repairing things and recycling things and composting things.
I agree with all that. I just don't know what the right number is.
Well, we
Also
can just
adding,
say,
another thing to add here, and this is really important, Local Law 97. When it costs money it costs emission, it's emission. How much emission does it take to burn or to recycle or to transport the trash and all of the stuff that we consume? That should be calculated in Local Law 97 per building. Oh, I
Well,
mean, like this, you're gonna highlight a lot of people gonna wake up.
yeah, that's a good idea. I hadn't thought of
yeah,
that.
well, the big issue there is all of the truck traffic.
Right.
Yeah.
Well, they haul a lot of it with the CSX, the train that leave at 2
Trains.
a.m.
Yeah.
But regardless, it's a transportation
Yes.
and plastic going into the ocean and all of that stuff that need to be calculated as emission per into Local Law 97 per building. We have to. This just nobody's gonna wake up if people
right, well-
need to pay. Otherwise, they will forget.
Okay. Well, do we want to take any
Okay.
action on this proposed resolution?
If we want to take action, yes.
I'm asking, does the committee want to take any action on this proposed resolution?
Yes, we do. I mean, I am. I'm sorry.
Are you making a motion?
I am
Me-
making a motion to accept. I don't have the name of the resolution.
Well, Yeah. Are you making a motion that we should adopt this resolution
Yes,
as it
that's
will
correct.
as it will be
Amended.
as it will be amended? Yes.
Yes.
Is there a second?
I'll second.
You're all set.
Okay. Okay, Mr. Banner seconds. Okay. All those who wish to vote in support of that resolution, please raise your hands.
Can you count our hands this way?
Well, I only see OC's hand.
Maybe it's only OC.
Okay, I tell you what. Let me call the roll.
I'm sorry, Steve, before you call the roll, can you explain what we are voting for? We are voting to review the resolution and then work with it, or
Steve,
is that?
I'm sorry. Say that again, Darlie.
I just want clarity to understand what we are voting for. Are we voting on taking that resolution to review it and then at some point submit it? Is that the vote that you are calling for?
Yes.
I see Osi shaking her head.
Yeah, because I thought we were voting on a resolution to be presented to the entire board.
Oh yeah.
How can we vote? But we barely just saw this in a moment and read over the meeting.
Okay. Well, Maggie, what is the timing on this? Can we do we have another month in which can we vote on this next month?
Well, this is my understanding, that the DEC is not expecting a final plan from the city until sometime in the summer.
Oh,
Now, they've
Okay.
given deadlines to comment, which have come and gone.
okay.
So, we don't want to dawdle too much.
Okay. No, that's fine. But maybe what we should do is take a little more time and develop maybe a more precise resolution that we're comfortable with, and bring it back to the committee next month. Or Darlie, how does that sound?
That sounds great. And even if we come with a maybe just to circulate the resolution for each of us to see, read it, provide comment. It could be done. I don't know if it's okay to do it over email.
No.
If we don't want, no, okay, I said it. I see a bunch of shaking head.
No, we can't do it. You can send your comments directly to me.
Okay.
We're just not supposed to have a committee-wide discussion by email.
Okay, perfect. Then I guess you can send it to all of us, and whoever wants to send their comments to you,
Very
do
good.
that.
And then
And then when we come back next month, we probably will
Yeah.
have it something.
yeah, and at the next meeting we can have a more thorough discussion.
And if anybody has any questions of me, I could answer in the intervening month.
Oh, yes. Well, we know that you'll be available as a resource. All right. Jacob, do you have a question or comment?
I do. Just to say that I think fine if we want to revisit the proposed resolution in our next meeting. But to Maggie, thank you for coming and presenting on this tonight. I'd be ready to adopt this resolution right now myself. And I think waiting will give us a little more opportunity to hone the language, as Steve suggested too, which will be good. So,
right.
but just really thank you for coming and raising these points. I think you probably may be one of the most knowledgeable people about this issue anywhere in this city. I'm really impressed. Thank you.
All right.
Thank
Well,
you.
then, Richard, you have something?
Yeah, about one sentence worth. Echoing what Jacob just said, I originally raised my hand for a motion to table, but I don't think that's necessary at this point.
No, it's not necessary. All right, very good. So we know what we're doing. Thank you, Darley, for bringing up that point. And
Thank you, thank you all, and Maggie, thank you so much. This was incredibly helpful and inspiring, I have to say.
Thank
all right,
you.
all right.
And by the way, you know, if you're interested in doing double duty, there, you know, you can always join the Manhattan Solid Waste Advisory Board and attend any of our committee meetings or full meetings without even being a member.
All right. Well, don't you try to steal any members of my committee.
I said double duty.
Yeah. All right. All right. Thank you very much. And thank you for bringing this issue before us.
Okay.
You know, as you may recall, when I worked for Councilmember Michaels, we spent a hell of a lot of time working on the 1992 plan.
Yeah.
All right, so let's move on to next item on the agenda was to be a report from our Department of Health and Mental Hygiene liaison, who unfortunately is not able to join us tonight. But let me just briefly say that the Department of Health and Mental Hygiene website does, give some information about the status of respiratory illnesses in New York City for the week ending January 31st, that being last week, for COVID, flu, RSV, and other diagnoses, showing that there was a slight decrease in emergency department visits from 9.89% to 9.31% of the total ED visits in terms of the percentage devoted to these respiratory illnesses. COVID cases were stable, exactly the same from one week to the next, 0.22% each of those weeks. Flu decreased somewhat, 0.81% down to 0.52%. RSV was stable, 0.34% to 0.35%. But Pauline did send me a press release that was issued today, indicating from the health department, they released new data showing that there have been 144,000 flu cases this season in New York City. So flu continues to be a problem, to be a major issue. And 52% of the flu cases in New York City are among children under the age of 18, which suggests maybe that children are not getting the flu vaccine. So that is still a major issue. Next on the agenda is a report from New York Presbyterian Hospital. Julio Batista has.
I'm sorry, Steve, I need to ask you a question before you move on. What about any information about measles?
Well, I didn't see anything on the website, but then again, I may not have looked hard enough.
Okay.
All right. So Julio did submit a written report. All right, let me briefly go through it. So with in terms of the COVID and flu data from the hospital, he's saying that they still are troubleshooting the dashboard. As of today, they are still seeing some discrepancies in the data, so they didn't have anything they could share with us at the moment. In terms of the nurses' strike, he says here, I was optimistic and could not have imagined that the nurses' strike would last this long. He says the New York Presbyterian continues to negotiate in good faith. Hospital operations continue to run smoothly. We remain hopeful that modifications and demands will help lead to a resolution. We'll be hearing from the Nurses Association, undoubtedly giving us a somewhat different perspective in a little while. On the governor's proposed budget, he says that it proposes new investments to hospitals, continued support for Medicaid rate increases. Hospital is pleased with the investments, looks forward to working with the legislature for continued support. United Healthcare, as you may recall, New York Presbyterian and United Healthcare are under contract negotiations. The deadline to reach an agreement was last month, has now been extended to the end of March. The Center for Community Health Navigation is hosting another virtual pediatric asthma workshop on Thursday, February the 12th at 5:30. I've circulated the flyer, I believe, to the rest of the committee, and I'll be asking the community board to send it out. And at our next committee meeting, he's confirming that they are going to do a presentation on the community health needs assessment and the community service plan. All right, next on the agenda is a report from Columbia University Irving Medical Center, and we are joined by Diego Quintuna, Community Affairs Coordinator. Diego, you are with us, are you not?
Hi, everyone. Can you hear me?
Yes, go ahead, Diego.
Okay. Good evening, everyone. So this is a report from Columbia University Irving Medical Center. So research and academic highlights. So just to start off, breast cancer, risk markers and physical activity linked in adolescent girls. So a new Columbia University study suggests that recreation of physical activity in adolescent girls is associated with lower breast density and reduced stress-related biomarkers, independent of body fat, which may influence future breast cancer risk. This research is particularly important because it focuses on urban Black and Hispanic girls, groups historically underrepresented in breast cancer studies, and at a higher risk for aggressive subtypes. The findings highlight the potential impact of promoting physical activity early in life as a strategy for breast cancer prevention. And I included a link if you wish to read more on that research study. There's also the ALS may be an autoimmune disorder. So Columbia researchers have made major strides in understanding and potentially treating ALS by identifying key mechanisms behind the disease. So one team found strong evidence that ALS involves an autoimmune response where inflammatory cells attack neurons, suggesting that modulating the immune system could slow disease progression. And a second team demonstrated in mice that gene therapy can rejuvenate neurons, making them more resilient and delaying symptom onset, offering a promising avenue for future therapies. And I also included the link there. And GLP-1 weight loss drugs and cancer. Is there a link? So GLP-1 weight loss medications like Ozempic and Wegovy help treat obesity and improve heart, liver, and kidney health. Current evidence shows these drugs do not increase cancer risk and may even help lower it. Research by Dr. Don Hirschman, professor of medicine and deputy director of the Herbert Irving Comprehensive Cancer Center here at Columbia University Urban Medical Center, highlights that GLP-1 use supports healthier lifestyles, better long-term metabolic health, and potentially improved outcomes for people with or at risk of cancer. Overall, they represent an important tool for both individual and community health by addressing obesity and its broader health consequences. And I also included the link there if you wish to read more. University school leadership appointments. So Columbia University's Board of Trustees has appointed Jennifer L. Mnookin, a nationally recognized legal scholar who serves as the Chancellor of the University of Wisconsin-Madison, to be the next president of Columbia University, effective July 1st, 2026. Dr. Mnookin brings deep experience leading a large research and intensive university, including a medical school, affiliated health system, and diverse academic community. At Wisconsin-Madison, she advanced major investments in research infrastructure, launched cross-cutting initiatives in artificial intelligence and human health, strengthened access and affordability, and guided the institution through a challenging federal funding and regulatory landscape. And then at the medical center, Jonathan Merman has been appointed as the next dean of the Milliman School of Public Health and senior vice president at CYMC, effective March 2nd. A distinguished physician, epidemiologist, researcher, and organizational leader, Dr. Merman has spent decades advancing public health research practice and policy at the highest levels. He most recently served as director of the National Center for HIV, viral hepatitis, I think that's how I pronounce it, STD, and tuberculosis prevention at the Centers for Disease Control and Prevention, where he oversaw an annual budget of $1.5 billion and 1,800 staff, and also led national efforts to prevent infectious diseases, reduce health disparities, and translate evidence into effective public health action. Yes.
Chances are that that maybe he found staying at the CDC to be somewhat untenable with the current administration, and fortunately found a place where he can do some legitimate work at Columbia. I'm just reading between the lines.
Got you. And then upcoming events and opportunities. Yes, go ahead. I'm sorry.
No, go ahead. Go ahead.
Awesome. Upcoming events and other opportunities. So State Pre-College Enrichment Program, SPREP. The applications were released on February 1st. SPREP is a free high school and college preparatory program designed for 7th to 12th graders who are interested in pursuing a career in medicine or other related STEM fields. And the deadline to apply is April 15th. And I also included the link to apply. InTouch program applications out now. So the Columbia Institute for Training Outreach and Community Health, InTouch, trains volunteers from churches and community-based organizations to conduct free health screenings and provide medical referrals. This is a free 8-week program which covers topics such as stroke, diabetes, hypertension, and healthy eating. And it also includes hands-on skills like blood pressure measurement and A1C testing. Participants will gain Columbia CHW certification and also have opportunities to engage in alumni and research activities. This training period is from March 26th to May 21st, Tuesdays through Thursdays from 10 a.m. to 1 p.m. And I also included the link there if you know of anyone that's interested in applying and learning more. Saturday Science, Your Brain in Bloom. So this is an upcoming event exploring how brains grow, adapt, and bloom. This will be held on February 28th from 1 to 4 p.m. at the Columbia Jerome L. Green Science Center. So this is through hands-on activities and other interactive demonstrations. You can learn how the brain develops throughout life. And this event will be held at 605 West 129th Street. And I also included the link if you wish to register as well. Parkinson's disease, how to talk about Parkinson's in your community. So this is an upcoming workshop. I think will be hosted in 2 days, where participants will gain basic knowledge about Parkinson's, identify available resources, and establish topics of conversation to help educate the community about Parkinson's. The course will be offered on Friday, March 13th and Saturday, March 14th from 10 a.m. to 1 p.m. This event will take place at the Columbia Community Partnership for Health office at 394 Washington, ground floor. And if you wish to learn more, please contact Ellis Moreno, and I also included his email there. If you wish to RSVP. Another upcoming training, I guess you can say, a hands-only CPR stop the bleed training. So Columbia University Urban Medical Center, New York Presbyterian, and the American Heart Association, in collaboration with CSD6 and the Injury Free Coalition for Kids, they will be hosting a hands-on only CPR and stop the bleed training and a health talk on your children's emotional wellness. This training will be held on Saturday, February 28th at PSIS 278, located at 3761 10th Avenue, from 8:30 a.m. to 12 p.m. Community members who are interested in this training must RSVP by February 20th, and I also included the link there. Northern Manhattan and Harlem Neighbor Appreciation Days on Saturday, February 21st at 2 p.m. There's a game, Columbia versus Dartmouth men's basketball. I totally mispronounced that school's name. Sorry about that. But families who live in Washington Heights or Inwood or Harlem can claim 4 complimentary tickets to attend the game. And I included the link there, and it will be at the Lydian Gymnasium at 3030 Broadway. And then last but not least, Heroes Night basketball game. So this basketball game will be on February 27th at 7 p.m. Columbia versus Brown men's basketball. And again, this is just to celebrate our community, active duty military members and members of the FDNY and LAPD. They're eligible to receive free complimentary tickets through the Heroes program. And again, the match will be held at the Lydian Gymnasium. And I included the number there to claim tickets as well. Yeah, that's our report for this month. Thank you. You're muted, Steve.
All right. Well, I was complimenting you on doing another very thorough report. But let me ask you, I'm a little confused by the flyers that you sent along about the health screening van, because it doesn't say where the van would be located. So
Yes, the van is usually moving around for some reason. They don't really have a specific, how do you say, like a parking spot, I guess you can say. It's usually located downtown by the Will Cornell campus, if I'm not mistaken. We're trying to see, bring it more uptown to other local events and schools. So we're trying to, work with that team that oversees the lung cancer van, because I did get word from a few CBOs that are interested in the van. So we're just trying to see, how the calendar works and how we could bring the van up here. Hopefully once per month or twice a month. Well, we don't know, but we're working on that. So I'll send you a calendar.
okay.
If they have one of where they will be throughout this. I think they go throughout the city. But I'll get you a calendar.
Okay, but obviously
yeah.
obviously we're most interested in knowing when it's going to be in our community.
Yeah, exactly. So I'll get you the information.
Okay, very good.
Mhm.
All right. Any questions from the committee?
Yeah, I do have a question slash comment. I don't know if I think we should invite invite a doctor or doctors that can talk to us about the connection of casein, which is a protein that's found in cow milk that actually promote cancer. Diego, you talked about cancer, and I just was thinking about it. I know that the food industry is not going to be happy, and also the pharmaceutical companies. But it's time to start talking about nutrition and health. And I think if the hospital is a university have some information or some doctors that do some research about it, that would be great to bring them for a presentation. Steve?
Fine by me. How do you spell what was that ingredient that you were referring to? OC?
Sorry, I was sorry, hold on, let me find the right spelling. It's a protein that found in cow milk that actually promote cancer growth. So let me look at spelling. Hold on.
Diego just wrote something.
Okay.
I think it's the CASEIN, I think.
Correct. You
Okay.
are correct. Yes.
All right. All right. So Diego, could you look into that for us and see whether there's somebody at Columbia who could speak on it?
Yeah, okay. I'll work on that for sure.
Thank
All right,
you.
No. Thank you.
Okay, very good. Okay, all right, very good. All right, next on the agenda, report from the Isabella Geriatric Center, and well, God, once again we got her title wrong. It's Diane Ashley, the Chief Marketing and Communications Officer for MJHS, and she has, I think, an important bit of news to convey to us. But I don't want to steal her thunder. Diane, I turn it over to you.
Thank you so much, Steve. Hi, everybody. Let me just get the house cleaning part out of the way. No cases of COVID, flu, RSV, or norovirus.
Oh, fantastic.
So, pleased to report that. And I believe it's 70% of residents that are vaccinated this flu season. So,
Okay, but everybody at Isabella is healthy.
at the snapshot as of today, when I asked for the data, was 0000. So,
Okay.
so that's terrific. About 3 months ago, I reported that we made the difficult decision to pursue selling Isabella. I wanted to provide an update today, which is that we've identified a buyer and entered into an agreement to sell both the real estate and the assets, which includes obviously Isabella Geriatric Center, to an affiliate of Casenna Care, and they are one of the region's most trusted and experienced nursing home operators. So, as I had mentioned before, the regulatory process is extensive. We do not anticipate that this will close until sometime in 2028. Nothing's going to change about the scope of work or services that we provide. What else did I want to share in that regard? Don't anticipate that during this 2-year period, and frankly beyond, that our residents will, or their families will, experience any change in care or quality on a day-to-day basis. And we have hired Casenna as a consultant to help us improve operations during this time period. So that is another piece based on their extensive experience. So we will be, taking advantage of their expertise. So
All right,
that's what I wanted to share today.
All right, well, thank you. That is big news, and hopefully it signifies positive change, and the fact that Isabella may now be on steadier ground, and its future insured. So, but please keep us posted as things continue to develop there.
I will do that.
And we're assuming that this company understands the importance of Isabella to this community and really to the city as a whole. And,
Right. So yes, I had reported to you guys that we had important criteria that we had established as we were doing the search process, and as I reported earlier today to the chair of CB12, when he asked me the question, he said, "You had those criteria, did you meet them?" And the answer is yes. And so, yes, they understand the importance of Isabella to the community. Understand, appreciate, value, So,
But they're not buying Isabella just to have the land. What's the
no,
difference?
no. They are committed.
making
They are a
different-
large nursing home operator. This is what
Right.
they do.
Right,
This is
very
their
good.
bread and butter.
Right.
You know, so this will be, I believe, a very good thing.
Very good. All right. Well, continue to keep us posted.
We'll do that.
All right. All right. Thank you, Diane.
Thank
All
you.
right. Okay. Next is an update on the status of the negotiations with between the hospital and New York State Nurses Association. Back with us once again is Sophie Boland. Really, Sophie, we love seeing you, but really, I was hoping you wouldn't have to come back here. And we also have Nicholas Artur, the political organizer for the union. Sophie, what do you want to tell us? And please tell us you have good news.
I wish I did. So today is our 25th day on strike. We have made some small progress, but many of our priority items still remain on the table. These items I know I've talked about a few times are improvements to our staffing and our staffing enforcement language, which helps hold us, the hospital, accountable to the staffing that they have promised us in our contracts. They are saying it's too expensive. And we say if they agree to our safe staffing language and if they agree to staff the hospitals as they've said that they would, it won't cost them any extra out of their budget. The second thing is our workplace violence protections. I know I've talked about this as well. And the incidences of workplace violence that nurses experience when they're in the hospital. And we have a whole host of suggestions and things we'd love to implement and that have been implemented in other facilities and have worked well. Some of these things are first names only on ID badges to help protect the identities of the nurses. We want weapons screening and security at every access point to the hospital to make sure that staff and patients are protected. We want panic badges that will you like press it, it's attached to your ID badge. You can press a button and there's a GPS that helps staff get know where you are in the hospital, where you need help if that staff member is in danger. And then the next thing we're asking for that's still on the table is language to protect nursing jobs. One from being replaced by AI and technology, and then I came here, several months ago to talk about the layoffs that were happening throughout NYP that they did last year, where they were replacing union jobs with cheaper non-union labor that they could work for longer hours and for less pay. And then the next thing is language that helps guide nurse interactions with law enforcement and places the responsibility for handling those interactions in the hands of management. So that necessary health care can be done by the nurse and that it's not hindered. The last thing is still on the table is our healthcare and pension. Those things have been contingent on an agreement in other areas. So we still don't have a formally signed off agreement on our healthcare and pension, which is really distressing for healthcare workers to not have those things secured. We are distressed to hear from patients about the conditions inside the hospital while the skilled and specialized nurses are outside, and we are incredibly eager to get back inside, caring for the patients in the community that we love. And while we have been out, we have appreciated all the support that we've received from many members of the community who've come to our picket lines and shown their support on social media, all of which have been so crucial to help support our fight for a fair contract. And those are the updates. I wish I had better news.
Why am I so out of focus here?
That's a good question, Steve.
What the hell happened?
I think your video died.
I don't know what happened there.
It's blurring the whole thing rather than just your background.
Oh my God.
Maybe take the blurring off.
Oh. All right, let me try to fool around with this. But Sophie, let me ask you, I thought I read that there was at least agreement on the on the two issues involving healthcare benefits and the use of AI. I thought progress had at least been made on those two issues.
Yeah, so we reached agreement on AI to help kind of become part of the process in how AI is implemented. Where we didn't secure sort of like a firm agreement is that is our we call it non-replacement language. So you can't replace a union bargaining unit nurse or a union nurse with and any kind of non-union replacement, and that would include AI. So we have some pieces of an agreement, but not total pieces of an agreement. Where our healthcare is concerned, so there were kind of two issues with our healthcare. One of the issues was that the hospital was trying to cut costs by cutting our healthcare and our benefits that we currently have. The other piece was that they wanted us to pay into our healthcare. And as we know, healthcare costs are increasing. Where we find fault with the hospital is that the reason that healthcare costs are increasing is because they're increasing them. So, it's hard to justify having us pay for it when the reason that healthcare costs so much money is because of institutions like NYP, unfortunately. So that was what you may have heard. They're not cutting. They've agreed to not cut our benefits, but they haven't agreed to no out-of-pocket costs for healthcare workers.
Oh gosh, now you have to see the condition of my office.
Reminds me of
You're just
Stanley's
reading a
office.
lot, Steve. That's all.
Right. So there is no firm agreement on either one of those points?
So there's firm agreement that they won't cut our benefits,
Right.
but there is not firm agreement on not paying into our own premiums.
Oh God.
Yeah.
Oh Jesus, there it goes again. All right. Are there any other questions? I'd say I started writing a resolution, but I didn't finish it. But I would like to do a resolution that at least puts us on record, calling upon the hospital to bargain in good faith and to finally reach a settlement without any further delay. I mean, this has just gone on way too long. This is insane. To have the nurses out walking picket lines and in this weather, we want them working, and there's got to be some way in which people can come to terms and come to some agreement. But by the time I mean, I'd like to do a resolution tonight, but God knows if it comes before the community board in another 3 weeks, I can't believe the strike would still be on at that point. I don't know.
So, Steve, if the strike,
what do the members want to do?
so if let's do a resolution. If the strike is finished and done, we can rescind the regular resolution, right? You can do it on the floor on the general meeting.
It would be a moot point. But I certainly, if we don't need to vote on a resolution calling upon calling upon the hospital and the union to reach an agreement, that would be great if the agreement has actually been reached. But I think I feel as though we need to do something.
Okay. So let's do it.
I don't have the whole thing together, but basically it's the thrust of it is to talk about what's been going on, how this is the longest nurses strike in New York City history, that the nurses perform essential functions, that patients inside the hospital rely upon them to a great extent, and the people basically who address the concerns and respond to the needs of patients, more than anybody else in the hospital. And we don't want to lose them. We want to keep them. They're so important. And we want to see an agreement. We want to, we want the strike to end. So, I mean, there's a lot more language. There will be a lot more language to it. but that's basically the thrust.
Thank you so much.
Richard.
You
Richard,
muted, Richard.
yeah, Richard, you have to unmute yourself.
I would move to authorize the resolution in concept as just presented by the chair, Steve Simon, pending review, circulation of the final resolution to members of the committee.
Is there a second?
I'll second.
Right.
Okay, OC
No,
seconds.
no, go ahead. No, Jacob, somebody else can
No,
second.
no,
That's
I'm
fine.
fine. Go ahead.
Second.
Please,
I'm
don't,
sorry.
I'm taking the minutes and I say OC second.
please, if you have to fight over something, find something else to
Sure,
fight
I'll
over.
second.
Oh, now somebody else. Who's that one?
I second.
Is that back to OC?
Darling.
Oh,
Darling.
Darlie. Now it's, oh my God, I got 3 people fighting over this. Okay.
It's 9 o'clock.
Okay, very good. Okay, so, where's my, okay, OC, do you vote in favor? I'm sorry, I take that back.
Of course.
OC, how do you vote?
Yes.
Okay, Mr. Allman, how do you vote?
Yes.
Mr. Banis, how do you vote?
Yes.
Ms. Corneal, how do you vote?
Yes.
Mr. Francis, are you still with us? No, I think he logged off. Ms. Woodley, how do you vote?
Yes.
All right, Mr.
Sorry,
Simon,
yes.
Mr. Simon also votes yes. So, that means, 6 votes in favor, none against, none abstaining. Oh, 1 second. All right, we have some members of the public. Well, really, it's just either, oh no, you got Maggie. Maggie, do you wish to vote?
Sure.
How do you
I
vote?
vote yes.
You vote yes. Ms. Boland, how do you vote?
Yeah.
Okay, Mr. Artur, do you wish to vote? How do you vote?
Vote yes.
He's not sure. Okay. Oh, he votes yes. Okay.
Yes, I vote
Okay.
yes.
All right. So, in
Thank you.
terms of our guests, 3 in favor, none abstaining, and none voting no, and none abstaining. Okay, Jacob, you have those votes?
We got it. We're good.
Okay, it's just, in terms of the committee, 6 in favor. In terms of the public, 3 in favor. Okay, very good. All right, so we're going to finish that off and bring that to the full board. Okay, we're up to old business. I circulated the latest stats from the Department of Environmental Protection for the month of January. 223 service requests from Community Board 12 residents. Number 1 item was leaking hydrants, 23. Running hydrants was 19, and construction noise before and after hours 20, and there were 19 lead kit requests. You recall that at the last meeting, a member of the public came to complain about some odors coming from the area of Audubon Avenue and 171st, 172nd Streets. We've been promised by DEP that they will be sending an inspector. It hasn't happened yet, but it should happen shortly. And a question was raised, actually, I think by Maggie Clark at the last meeting, inquiring as to whether or not DEP or the health department is continuing to test wastewater for traces of COVID-19. Turns out that the answer is yes. They are checking, and I believe the response we got back is that they're doing it maybe twice a month. The other bit of old business, perhaps, is that we also had a brief discussion about the fact that the Traffic and Transportation Committee was hearing from people about making a possible change to our alternate side of the street parking policy. They did have a brief discussion at their meeting last week. No. This last Monday, I participated in that discussion. There were basically two people, I believe, who were saying that they would like to see us go back to having alternate side of the street parking twice a week on each side of the street. There were actually three people, counting me, speaking against that idea, saying that we should continue to keep the current policy, which we consider to be environmentally advantageous and beneficial to the community. And there was some discussion about whether or not there should be a public hearing on this question with the two committees participating at a later date. At the time, I said, okay, we could possibly do that, and maybe we should, but I really don't see, based on this discussion the other night, that there's really a major public outcry about having us go back to twice a week alternate side of the street parking on each side of the street. And I would, and as I said the other night, and I've said it a number of times, I consider this the reduction in alternate side of the street parking to have been one of the major accomplishments of this community board over the last 25 years that I've been on this board.
As everyone else should feel the same, because that means that if that means that the streets are clean enough that they don't need additional cleaning. And on top of that, let me go back to emission again. I'm sorry. I don't know, somebody else is talking with me. So in terms of emission, we're going back to, what are we really doing? We are adding more emission. And as we all know, emission, that means that we're going to add asthma to the asthma rate. Like, and it's especially, so this is really not something, we shouldn't change it. We should keep it the way it is. If there are any issues in like spot issues, maybe sanitation can add like, I don't know, one time a week with very specifically on a very specific
No, they can't.
targeted area. But if it's not the case, just leave it the way it is.
No, they can't. They can't really do that. In fact, I mean, this whole thing arose from the fact that I was approached by one of our elected officials' offices, asking whether or not we could change the policy for just one particular section of Washington Heights. And when I did the research, I found out that it has to be district wide.
Oh,
And
wow.
they're not going to put up different signs on different streets within the same district. So actually, when I saw that, I said, "Oh my God, this is fantastic! You mean we could actually do this for the entire district?" And and it turned out that we qualified for that reduction because our street cleanliness ratings were at 90% and above for a extended period of time. And I said, "Oh my God, we actually qualify for this." And then it turned out that it wasn't. It wasn't optional, that once the community board asked for it, the sanitation department had to agree to do it. That was the way the law was written. So in almost every other case, when the community board asks for something, it's advisory. We don't have any final say. In this particular instance, we actually had the final say, and they had to. It took a while. We passed a resolution in 2011. The policy didn't actually go into effect, and they didn't change all the signs. They had to change signs on every single street, and it took them a couple of years to do that. So it didn't go into effect until 2013. So we've had this policy in effect in our community for close to 13 years.
13 years.
And I would say that we've saved people from having to drive around the block, God knows, tens of thousands of times. We have probably saved a hell of a lot of automobile exhaust and emissions over this period of time. And I would, I agree with you, OC. I think it would be a mistake to go back. But be prepared, because there are some people who are arguing the other side. And
why? Why are they arguing? Because of parking?
I mean, one guy thinks that if people have to move their cars, he's going to have a better chance of getting a parking spot. But really, it didn't make any sense to me because I mean, he was talking about how he goes to work, he drives his car, comes back at, I don't know, 6 o'clock. At 6 o'clock, everybody's back to where they were before. There aren't any new spots opening up. It doesn't make any sense in that particular case. And I think, you know, maybe somebody else was arguing that the streets are now much dirtier. I don't know if that you know, that's sort of anecdotal, and I would argue that it's not true. So that's where we stand at the moment on that issue. Any other old business? Oh, hold it, OC, you have some old business.
Yeah, but Richard is raising his hand.
Well, Richard's business is older than your business. Okay, Richard.
In the name of moving forward, I'll defer.
You'll defer to Ms. Kamina?
It's 9:10. Let's keep moving.
Okay. OC.
I forgot what I was going to say about the ASPCA, right?
Yes, you're trying to get data from them about
So I'm
about
trying to get data. First, I'm still trying to get the person that can tell us more about the you know, the vans, the spay neuter and wellness vaccination vans, but so far I can't get him to come to our meeting and give us some more information. So I'm trying to get the data via email, see if if he can tell us, if the ASPCA can tell us how many dogs and cats got fixed on the mobile van in 2025. And so we have some numbers. Yeah.
All right, very good.
I just wanted to bring up the Legionnaire stuff at 3333 Broadway.
Oh,
I
yes.
just want-
Yeah, go ahead, Bristol.
Yeah, I just want to know what we're going to be, you know, getting ahead of the curve, what Washington Heights and Inwood need to do so that, you know, they're doing routine tests for all these major buildings, even the small ones that might get overlooked, so that we don't end up in a condition like 3333 Broadway.
All right, well, that's an excellent question, and let me raise that with our health department representative to see what action they're taking, preventive action they're taking in our district on that question. You know, for those who are not aware, 3333 Broadway is at 135th Street and Broadway, and is a huge complex. And I believe they recently found 2 cases of Legionnaire's disease there. Okay, anyone else? Okay, new business. You may be aware that the Zeta Charter School is planning to construct a new school building at Broadway and 181st Street, the vacant lot on the northwest corner. And as part of that process, I guess they're requesting maybe a zoning variance. They had to prepare an environmental assessment statement, which Wayne Benjamin, the chair of the Land Use Committee, forwarded to me the other day. I somehow do not believe this, but I looked at the file and it says that this EAS is 8,534 pages long. So I haven't had a chance to read it yet, but and I don't know that I ever will. But so I spoke to Anthony about the fact that we really, this community board really could use a consultant, somebody to help us read through these documents. We whenever we have like a brownfield remediation plan, we also get very technical documents and nothing this large, but it's also difficult to read through those and to make sense of them, to understand them. And Anthony says there are other community boards that do have consultants that they hire for purposes like this. So we're going to look into that. But in the meantime, we're going to have to take a look at that EAS, and I'm going to send it to all the committee members. And I'm not saying you have to read every page by the next meeting, but please take a look at it and see if you find anything. And because I think we may have to invite the Zeta Charter School to our next meeting, or or maybe I'll see if we can buy some more time and invite them to the meeting in April. But this is something we're going to have to look into, at least to some extent.
And I'm assuming the EIS is available to the public, right?
I don't know, but I don't know whether it's been publicly filed anywhere. But that's a good question. We should find out.
It should be.
I
Uh,
have a question.
Darlie, you have a question?
Yes, more like a guidance. Is there anything, red flag, specific language that you would recommend we look for when we are reading through it, or scanning it, or skimming it?
Well, I tell you, the major concern I think that's come out so far is the extent to which the school is going to have an impact on the traffic at that particular intersection, which is, got to be one of the busiest intersections anywhere in Washington Heights and Inwood, and we've had a bad experience with some other charter schools where they generate a lot of automobile traffic with people, parents driving the kids to school, picking them up afterwards, and this is one place where you just don't want to have too much traffic and too much double parking. So I'd love to see how they speak to that question in this document. Actually, Jacob, you're a member of that land use committee, so maybe you could help us.
Yeah, I don't want to take too much time because it's late, but I just wanted to say that, yes, I'm a newly minted member of the Land Use Committee. So we discussed this last night extensively. And to your point, yes, traffic was one of the main concerns. But from an environmental question, the question I raised to them is the school's proximity to I-95, which is a major roadway through our community, and just concerns around the impact of air pollution on the well-being of their students. So I would be really curious to hear from them how they're taking that into consideration. And then in regard to the environmental impact statement, I was told by one of the representatives that that information is in there on that. So I would like to look at that. And then also, Darlie, to your question, I think whenever we've had environmental impact statements circulated to this committee in the past, something that I've looked at is like, what are the impacts of construction expected to be in the area? Because they need to do all sorts of planning around how do we reduce construction noise and dust from construction and things like that. So I'm really curious to take a look at that.
For some reason, though, this is not a full-fledged EIS. This is not an environmental impact statement. This, even though it's 8,534 pages long, this is only an environmental assessment statement, which I'd love to know how they figured this out.
Yeah, I'm not familiar, but by a little bit of background, it may have something to do with the process they're in. And Wayne would probably be able to speak better to this, but the process they're going through right now is they're looking to get a zoning variance because the lot that they're building on has a couple different zoning. Sorry, this is all brand new to me. It applies to a couple different zoning regulations, and so they're looking for an exemption to one of them. So I don't know how much they have to provide as part of that process. Maybe they don't have to do a full EIS. I'm not sure, but
well, presumably somebody made an evaluation that the impact of this project is not so severe that it rises to the level of needing a full-fledged study, that they can just do this environmental assessment, which is a lesser a lesser look into its impact. Maggie, you have something?
Yeah, I've been writing in the chat about environmental impact statements and for the Inwood rezoning EIS. There was also a large EIS that nobody looked at. And I was the only one of the hundreds that were fighting, the rezoning that could do that. And I had to choose which one of the environmental effects was I going to spend time on in my 2 minutes of testimony that I'd be given. And it was traffic, because that would impact everybody every day. You would have ambulances getting stuck, fire trucks, police, buses, trucks trying to deliver, not just the car owners, it would affect everybody. And Inwood, and to, I guess, a lesser extent, Washington Heights, but Inwood only has 5 ways in and out. I mean, we've got Broadway in and out, and 3 ways to get onto highways. And it's not like a normal neighborhood where it's crosshatch and you've got maybe 10 in one direction and 10 in another direction. We're surrounded by water and parks. And so, when you have this, what they had in the Inwood rezoning one, where grade letters B through D transformed into mostly F, which is beyond full. E is at capacity for an intersection, and F is beyond capacity. So I call that gridlock. And so, no one's paying attention to this.
But I said at 181 in Broadway, you have, I forget how many different bus lines cross over there.
Yeah.
Going north, south, going east, west.
Yeah.
As busy as let's say Dykeman or Broadway or 10th Avenue or 207th Street, you don't have all of these bus lines that you have in 181 and Broadway. It's that's why the traffic issue there has got to be even worse than what you may have in Inwood.
No, not worse than Amber. No.
Amber is up on the hill there, but
right.
But
you have to see the traffic here in the morning.
But that's an example of how the charter schools draw these a lot of automobile traffic with people dropping off and picking up their kids.
Example of what not to do. Yeah.
Yeah. And there was a similar issue with the Success Academy that took over Mother Cabrini High School on Fort Washington Avenue, north of 190th Street. So this is a real issue. But so we're going to have to look into this. We'll see if we can put it off till April, but we may have to deal with it in March. Any other new business? None. Are there any announcements? None. Very good. All right. So our next meeting is March the 5th. We're already due to get a presentation from the hospital on the community health needs assessment and community service plan, and hopefully, as much as we like the Nurses Association, we're hoping they're not going to come back and tell us that they're still at an impasse with the hospital over their contract. We really don't want them to come back again and tell us that. So I want to thank you all for coming. I want to thank Crystal and Darley for your first meeting. The two of you were great. You helped. You contributed very nicely. So welcome aboard. And
I'm happy to be on board.
Okay, very good. All right,
thank you. You'll vote on a resolution about the swamp
in next month. Yes.
Yes.
Next month. All right, very good. And I'm sure we'll be in touch over the course of the next few weeks. Take care. Thank you all, and let's hope for the best.
Good night, everybody.
Bye. All right, we're adjourning this meeting at what is that, 9:25?
Yes.
Okay, Jacob, write that down. Take care.
Good night.